Hello students, I am Dr. KOMAL Rathore, Assistant Professor in KOMAL VIDHYA, Faculty of Ayurvedic Science in JAYOTI Vidhya Women's University, Jaipur, Rajasthan. So today's session we will talk about epilepsy or seizures. So first of all, definitions of terms. So here are different terms of epilepsy. So first is tonic. Tonic, increased tone or rigidity. Atonic, lack of movement and flaccidity. Clonic, rhythmic muscle contraction and relaxation. Myoclonic, brief jerk, twistage of muscles or group of muscles. Aura, perceptual disturbance before the onset of seizures. And automatism, coordinated involuntary muscles such as chewing, lip, and smacking. Now, etiology. It is 60% of idiopathic and genetic. Epilepsy due to single gene defect is rare. More often, an interaction of multiple gene and environmental factor is responsible. Example, gene encoding for GABA receptor, major component of inhibitory circuit, and ion channel. Etiology. New onset epilepsy of any type. Drug intoxication or drug withdrawal, especially missed anticonvulsant dose among children with pre-existing epilepsy, acute head trauma, infection, ischemic stroke, intracranial hemorrhages, metabolic disorder, example hypoglycemia, electrolyte imbalance, and hypoxia. Acquired. Acquired make injuries, head trauma, brain tumor, stroke, previous infection, birth defect, abnormal brain structure, or autoimmune diseases. Commonest cause of convulsions in neonates, HIE, CNS infection, hypoglycemia, hypokalemia. Treatment convulsions with phenobarbital, loading dose 20 mg per kg per kg IV. If they persist, add 10 mg per kg up to the maximum dose of 40 mg per kg. It is very important, commonest cause of convulsion in neonates. So we have to remember that. Pathophysiology. A balance between excitation and inhibition is essential for normal brain function. A seizure results when a sudden imbalance occurs between the excitatory and inhibitory force within the network of cortical neurons in favor of sudden onset net excitation. Synchronous firing of many neurons at once. Symptoms and type of seizures will depend on affected area of cortical network. Now, classifications. Epileptic seizures are generally classified as focal or partial or generalized seizure. First of all, generalized seizure originate within and propagate throughout both hemispheres. Include loss of consciousness, may include tonic-clonic, atonic, and myoclonic jerking. Widespread cellular, biochemical, and structural abnormalities. Grand mal seizures या फिर tonic-clonic seizures. Typically, the seizures begin abruptly. Consciousness and control or posture are lost, followed by tonic stiffness and upward deviations of eyes, pooling of secretions, pupillary dilations, diaphoresis, and hypertensions are common. Clonic jerks following the tonic phases. In the post-ictal phase, the child might be hypotonic. Irritability and headache are common as the child awakens. Petitmore, absent seizures. The clinical hallmark is a brief, less than 15 seconds, loss of environmental awareness, which may be accompanied by automatism. Example, eye fluttering, fumbling with the fingers, lip smacking, can be caused by a complex partial seizures. They usually begin between 4 to 6 years. Neurological examinations and brain imagings are known. The characteristics EEG pattern consists of generalized 3 Hz spike and wave activity. Can be provoked by hyperventilation or strobe light stimulation. Atypical absence, myoclonic and atonic seizures. Atypical absence seizure. Episodes of impaired consciousness with automatism, autonomic phenomena, and motor manifestations, slower EEG discharge, 2 Hz. Myoclonic epilepsy, usually it's associated with multiple seizures type, not all myoclonus are epileptic in nature. Atonic seizures, typically brief, lasting 1 to 2 seconds, are quite disabling because of sudden loss of postural tone resulting in fall and injuries. Second is focal or partial. Originate within and propagate throughout one's hemisphere. May have motor, tonic-clonic or myoclonic, sensory, cognitive, emotional, psychic or autonomic abnormalities, usually associated with local structure abnormalities. Partial seizures are common in temporal lobe epilepsy. Focal may progress to generalized with LOC. Symptoms will vary according to where the seizures occur. In the frontal lobe, speech, twisting, turning, and paddling. In the temporal lobes, a feeling of deja vu. In the partial lobe, a numbness or tingling. And the occipital lobe, usually disturbance or hallucinations. Simple or partial seizures. Simple partial seizure. A partial seizure without discognitive features. Usually the event is rememberable in details. Complex partial seizures with discognitive features. There is loss or changes in consciousness, awareness, and responsiveness. Patients may have steering and automatism, typically frontal and temporal lobe onset. Factors that increase the risk of development of epilepsy. The first is abnormal neurological examinations and development. Family history of epilepsy. Complex febrile seizures. Patients with 2 risk factors have up to 10% chance of developing a febrile seizure. Increased motility. Seizures before 1 year, triggered by temperature less than 39 degrees centigrade. And now, differential diagnosis for seizures. Fevers, meningitis, encephalitis, Beren sepsis, tetanus, birth asphyxia, head trauma, metabolic, hyponatremia, hyperbilirubinemia, hypoxia, toxins, ingestions, drug medications, withdrawal from drug or alcohol, stroke, syncope, arrhythmia, brain tumor or muscles, psychogenic, night terror, sleepwalking, migraine, etc. Now physical examinations, vital signs, mental state alertness, eyes, mouth, neck, cardiovascular, neurological, and skin. Then physical examinations have to be occurred. Then vital signs, blood pressures and temperature. Mental status, often lethargy and sleeping immediately after seizures. History of psychiatric disease, eyes, retinal hemorrhages, trauma, pupil edema, mouth, tongue and laceration, neck stiffness, meningitis and carotids, roots. Cardiovascular rhythms, murmur, stroke or emboli, neurological examinations, cranial nerve deficit, hemiparesis, paralysis, pronator drift, deep tendon reflexes, gaits and coordinations, frontal or motor, and skin. Other lab tool, first of all, blood sugar, fasting blood sugar, urine lysis, glucose, hypoglycemia, renal function test, electrolytes, hyponatremia or hypocalcemia. Burn is blood urea nitrogen. HIV, consider drug or alcohol screen, consider AST, ALT, bilirubin. LFT, consider electrocardiogram, arrhythmias. Imaging test, very important, EEG. EEG, electroencephalogram, should be performed if possible within 1 to 2 days on all patients with seizures of unknown etiology unprovoked. May be able to diagnose seizures disorder, may be able to predict future seizures or epilepsy. Up to 60% of pediatric cases of new onset seizures will have epileptiform abnormalities, often done with hyperventilation, light stimulation, or induced seizure activity. May also perform sleep deprived EEG if initial EEG is normal within 3 days for higher yield of abnormality. Now, second, MRI or CT scan. So, treatments, medicines type dependent. So, valproate, lamprodrozine, proprimate, alternative. You have to know what is the anti-epileptic drugs. So I have mentioned that name. So it's not very important for us, but we should know what is anti-seizures or anti-epileptic drugs name. So you should read that. You have to know what is it. Carbamazepine, phentoin, valproic acid, valproic acid is partial absence or typical in this is alternatives. Cholinapazam. Side effects of anti-epileptic drugs. Phentoin. Hypertensive, arrhythmias, poor coordinations, nystagmus, peripheral neuropathies, status epilepticus, phenobarbital sedations, causes, valproic acid causes thrombocytopenia, encephalopathy, hypothermia, hepatotoxicity. And now management stabilization. The first priority of treatment is to ensure an adequate airway, breathing, and circulation. Vital signs should be obtained and oxygen administration if needed. If respirations are inadequate, positive pressure ventilations may be required. IV access should be obtained. So it's all about epilepsy or seizures. I think, and I hope you should like it because it is very beneficial to your this session. So have you any query? So please mention below. Thank you.